Good morning, everyone. Welcome to another episode of Vietnam Innovators. I'm your host, Hao. Thank you for tuning in and week out. Without you, the show would not be possible. Today, we have a guest. He works here in Vietnam, but he's from Malaysia. He's worked all around the world, including in Saudi Arabia, revamping their medical system over there and doing the same here with Hoan My Medical Group. It's one of the biggest groups in Vietnam, covering all things health and medical. And Dr. Dilshaad will be here today to explain what his team is doing, what the challenges are, what their opportunities are. Thank you so much for being here.
Thank you, Hao, for having me.
Yes.
Morning to the audience.
I always ask my guests at the end of every podcast, and I'll do the same to you.
Okay.
So a bit of a preface here.
Yes.
What kind of subjects they'd like to learn more about? They're experts in everything from agriculture to tech to AI. I assume you in health, of course. And health comes up all the time.
Yeah.
And so it's a pleasure to have you here today to
Pleasure's
share
mine.
more about that and to hear what can people know more about and do about, hopefully.
Anh ấy ga lăng, anh ấy có gu, anh ấy năng động, anh ấy có một con gà màu xôi. Đừng để HPV biến bạn thành rất khác. Muốn né gà màu xôi phải đẩy lùi HPV.
Before I get into the podcast, maybe a quick intro. For you.
Yeah, so thank you for having me on the show, Hao. As you said, I'm from Malaysia and had the privilege of working around different healthcare systems on the globe. Latest one being Saudi Arabia, of course. But this is not my first round in Vietnam. I was in Vietnam before. I founded a healthcare group called Tam Tri, and then obviously went to FV Hospital and managed the expansion plan for FV as well. It's been interesting coming back to Vietnam. I came back in August 22 after COVID when the country reopened, and I've been heading Hoan My since. And it's been an exciting journey for us all the same. There's been challenges post-COVID, of course, but we see a lot of opportunity for us to move forward and continue to serve the country, being the foremost healthcare provider in the system.
Sorry, I didn't know that you were here before. I studied your background, more recent background.
Right.
How long ago between your first and
So
now
I came
second?
to Vietnam for a holiday in 2011 and met Dr. Tung, who was the founder of Hoan My. He had then left Hoan My and moved on to go on to his next venture. And through friendly discussions, there was no intention to join or come to relocate to Hoan My, but one thing after another, then he had asked me to come back after a few months to relook at things with him. And he offered me a job. So I was back in 2013. It was completely greenfield. Started off with me being the second employee in the company, and managed to build the system for him.
Okay.
Yeah.
So, I mean, Hoan My is not that old, considering its not only presence in the market now, but just the whole market in general.
Yeah.
I mean, as someone here who, I talk to a lot of health experts. There's the public system, of course, and you have names that have been around for a while. You mentioned FV Hospital, for instance. But Hoan My's relatively new, and I would imagine hopefully more agile, which we'll talk about in terms of innovation and what you hope to be accomplishing with the team.
Yeah.
And you have so many great people joining the organization recently, by the way, which we can talk about later. Well, how would you describe your role? Like, what's your day-to-day as a group CEO of a healthcare group? It's like any other business, I assume, but probably a lot more complex than the average company.
It is. Healthcare being healthcare, it's always more complex than the other businesses that we have around. But I think it's a busy role. Hoan My's been around for 27 years, by far the oldest system in the country from a private healthcare perspective. So you obviously have inherited a legacy that's done well. We see 5 million patients a year.
Okay.
And while we move forward, obviously change and innovation is going to be the most important thing that we do. So I think my day is always mixed with business strategies, a lot of operational insights. There's some level of micromanaging that needs to be done because now you're moving from a legacy system that was assembled from a lot of processes through growth. And Hoan My went through different ownership, periods as well.
Okay.
So most of the time I spend is obviously building forward when it comes to the future of Hoan My, and then catching up with the legacy as well to ensure that we build a system that's now standardized, integrated, and then scalable from a growth perspective.
Let's kind of set the tone a little bit about that innovation. It starts with the customer. It starts with the patient.
Yeah.
You've been here, or you were here 10 years ago. You've just returned. Have people's approach to wellness and health and the idea of prevention versus treatment changed over those 10 years? And if so, how?
Yeah, so definitely the mindset has changed. You see the younger generation obviously looking into wellness more than illness itself. Mental health has become one of the key discussions that we see happening around with different segments as well, including middle-aged individuals as well. Prevention and going into a longer longevity or longer productivity is the key discussions that we have with a lot of people. Aesthetics, beauty is very, very much on top of the list as well, where people stand. However, I think demographically, Vietnam's really shifting into an aging population. So we're seeing it was 11.9% above 60 in 2022, but we're seeing 13.9% in 2023 already. An average Vietnamese lives with 4 diseases at the age of 60 and above. And the exposure to disease is 14 years for an average Vietnamese. So I think there's a mix between, yes, the younger generation who want to live an active lifestyle, want to be more productive, reducing downtime from their personal perspective, where they go into a wellness, a discussion with us. But there's also this aging population that's already been burdened by disease, which we think is important for us to look at. So really, the complexity of the healthcare environment today is far different from 10 years ago. And now, obviously, patients have a choice. They also are better informed. The affordability definitely has increased in that sense, while you still see accessibility becoming an opportunity for us to create as well. So it's a good mix of how a country progresses from just looking after themselves when they're unwell, and now looking into not getting unwell and staying healthy all the time.
You mentioned a very interesting point about the aging population. We look at trends in North and East Asia where people are saying populations will be cut in half in 50 to 100 years, but also that birth rates are on the decline,
Correct.
People are aging. Vietnam, there's a concern about the middle income trap, that income isn't rising fast enough to meet those, let's say, health demands, social insurance demands and whatnot. Could you help quantify that? You mentioned it from 11 to almost 13, 14%.
Correct.
Let's say within the next 10 years, what does that number look like? And I want to quantify that a little bit so our innovators, hopefully in the health and wellness space, can meet those challenges sooner than later.
So we're definitely seeing decline in birth rates. Last year it was 0.98% population growth net. But we're seeing 0.84 this year. And then obviously by 2030, you'll see a more aged society, because then aging catches up with the longevity of 73.6 in the country. You're going to basically shift towards more people getting old than younger people being born as well. I think there was a study done about 2 weeks ago by WHO. Definitely the population is going to be reduced by 2054. We see that with a declining birth rate and an increasing death rate because of the aging society, you're going to see something in the 60s towards the terminal point where we see the pyramid shifting.
So people need to have more babies.
Yeah, so there'll be less. Obviously, with, as you said, the middle class trap brings families into a question of whether they should have more than one child or 2 children, right? So then obviously by choice, the growth will reduce from a birth perspective. And then obviously as the aging population declines by virtue of death, then you have a smaller population in the country.
I want to move down the podcast a little bit about what Hoan My is doing to meet those challenges, make sure people not only live longer, but also the young people are informed about what's happening in the society today. So what are those strategic initiatives to meet that demand as you just listed out?
Hoan My has always been a general hospital network. We grew from a very small clinic in Lee Thong Kiat Street 27 years ago. And what's gradually happened is we've grown into 21 healthcare assets across the country, mostly the middle and to the south. It's always been curative. It's always been reactive in the sense of people come to us as patients and, we've done well. But looking at the ecosystem today and looking at how healthcare spend projects into the population now, we've looked at every segment within the demographics of the country itself. And we see that there's an opportunity for us to look at different segments of the market where healthcare could be provided. Our main focal point is accessibility, and that accessibility basically transcends the segments altogether. Digital is a key driver of what we do today. So we're developing a healthcare platform on the digital front, which is going to be an end-to-end system that allows accessibility from the youngest person in the system to the elderly who can get his medication or get his doctor consultation done through a digital platform, just from a smartphone. Then moving into the wellness dimension, as we spoke, keeping people healthy and keeping them fit is where preventive is playing an important role. Vietnam's been very active, especially through regulations with production workers, manufacturing workers, the labor force being pushed through checkups on an annual basis for employment purposes. Looked at it very carefully, but we've also looked at how we can personalize wellness and start looking at screening programs which would serve individuals from a more personalized perspective as well. So what we've done is over the last year and a half or so, we've basically opened up Hoan My into a multi-brand platform. We look after the middle income group or the rising middle class from the Hoan My flagship perspective. We've also looked at a lower income group by creating an affordable care platform called Hoan My.
Okay.
And that's basically within communities where there's lower affordability, people can still access private healthcare using their social insurance to a large extent and still get the outcomes that they want from there. We've got Han Phuc, which is a mother and child hospital, which we brought on board the platform in the in 2015, 2016. Han Phoc's been now transformed into a multi-specialty hospital, a little bit more on the premium end of things. There's Yan E, which is our digital platform. So Yan E basically connects the omni-channel within the Hoan My system that allows us to now bring accessibility, but also look at the 100 million people in Vietnam to be connected to a healthcare system remotely as well. I think besides that, then we created the academy. Now, as we try to elevate standards of healthcare within our own system and provide healthcare for Vietnam, it's important for us to retain talent, that's number one, but also create new knowledge for the talent that we have. Those relationships that we've started building globally as well. So we've got relationships with the key healthcare player in Korea. Asan Medical Center is a key player with us. We've developed relationships with a couple of NHS trusts from the UK.
Okay.
We are in discussions with some players in Singapore as well to bring in high-end specialties that are not available in Vietnam for now. And we find that the opportunity that we have here is to reverse medical travel as well. So from a platform perspective, it's grown from just one brand, which was Hoan My, and we've split it into 6 new brands now that will provide more holistic care. And then designing the omni-channel itself so that it's an end-to-end loop of an ecosystem where you come in for wellness, you remain in the wellness domain. But if, for instance, somebody converts to an illness perspective, there's accessibility points where we work with in terms of people being able to access healthcare.
Hãy tự bảo vệ bản thân ngay hôm nay bằng cách dự phòng HPV và tầm soát định kỳ.
I feel like that's one of the main opportunities in Vietnam, this like always on healthcare platform.
Yes.
Because, and this goes for everyone in the world, but especially Vietnam, where now incomes are rising. So people are demanding this idea of premiumization, I guess you could say. That doesn't mean expensive or luxury. It just means that access, that always on awareness and education. And again, that goes with the whole discussion of prevention versus treatment.
Correct.
I'm American, as you can tell, Vietnamese American, and I notice in the West, and you could look at diseases such as COVID, just how different countries approached it. America was very treatment, which has its definite pros and obviously driven more towards getting the vaccine as soon as possible.
Sure.
Whereas in Asia, the use of wearing masks, for instance, was very high. And the idea of prevention from the very beginning, instead of getting it, then getting treated for it.
Correct.
So I feel like obviously something medical related, Hoan My has always been a presence for treatment, which is of course 99% of the use case I imagine in the system. But that prevention, how do you start with being that partner over a lifetime for someone that could have no diseases potentially, right? But they still need health.
So I think the society in Vietnam has always been reactive and curative. And you usually, in the past, you'd receive a patient coming to you at one stage, obviously because of awareness and because of patient education. So most importantly, I think from a touch point perspective, when it comes to educating people or the man in the street in general, that's where prevention starts, because really it's about awareness. So for breast cancer, for instance, we're starting off with a program in 24 where we actually have a mobile mammography running around the country. Well, we screen, of course, but it's going to be more educating people as well. We've done around 5,000 touch points, 5 million touch points already in terms of online interactions, physical interactions, CSR projects to educate public about awareness and prevention. For us, prevention is not just going out there and getting people to come in and get screening done. It's also very important for us to get the awareness on the ground. So there are thematic projects formed which have already been planned for 24 based on certain disease patterns that we think are important for certain target groups for us to interact purely on an education perspective. Nothing in terms of getting people treated or screening, but it's just to get people aware that there are diseases that could be prevented, and if detected early, they could actually be saving lives and increasing people's life expectancy as well.
You know, I want to share this too, because our audience on the broader Vietcetera platform is Gen Zs and Millennials, especially living in the cities. And my mom works in medicine. She lives here in Ho Chi Minh. She's a health freak in a good way. And she tells me how, you know, when you go in the evening, there's a lot of young people out on the sidewalks just enjoying, you know, time together. They're near the river. And she's shocked at how many of them are drinking sugary drinks in excess.
Correct.
And she was saying that how this is a huge opportunity to educate these young people, because obviously they'll go to convenience stores. They have money now. It's easy for them to access this kind of stuff. Even when I was growing up, it was actually difficult to access sugary drinks at such a large scale and processed food. And I don't think young people are really aware of the health risks that come with like the day-to-day kind of basics, like, you know, enjoy those things in moderation rather than drinking it like water. You know, simple things like that. It's a lot of opportunities there. I want to talk more about the team mindset a little bit and the leadership of Hoan My, even the staff that make everything possible. I mentioned off camera just now that your team has hired a couple friends of mine who've worked in very diverse backgrounds, not necessarily just health professionals, but thinking about systems and operations, and I assume new sorts of mindsets, this legacy versus innovation. Talk us through how you think about that, because innovation is so key to being not only competitive, but keeping sharp, making sure your services are working optimally. Talk us about that mindset you're trying to build.
So, as we spoke, I think most importantly is to emphasize that Hoan My is a Vietnamese born entity or a healthcare provider. And I always resonate this point back to the team, that this is what we build for the future. And it's a mix between experienced individuals. Some of them actually have worked with us for 21 years, 22 years, right from the beginning of Hoan My itself. And obviously that core knowledge of the DNA of the company or the healthcare system that we have is important to retain within the system itself. However, then if you're building something for the next 25, next 50 years as a generational business that we want to continue running in Vietnam and building a legacy of healthcare, it's very important for the younger generation to take a place now. And you mentioned Gen Z and Gen Ys. We started looking at individuals of that age group. I mean, the mid-20s, early 30s as well, even some young interns who come to us at 18, 19, to start shaping the mindset that they own this and they own the future of healthcare in the country. They are the influencers, because obviously to get into the Gen Z mindset or the Gen Y mindset, you need somebody from that generation to penetrate the change that you want to make. So there's this whole future building, if you want to call it that way, that happens in Hoan My, where there's a real good line, second line, third line even, who are being prepared to run the company for the future. Obviously, with Vietnam's position at this point of time, I mean, very resilient economy, growing very well, despite the fact that we have an economic slowdown. There's a lot of room for improvements when we benchmark against countries who've done well from a healthcare perspective. And that requires experience from a disruptive point of view and innovation point of view. So that's where we bring in subject matter experts from across the world. We've basically hired from Europe, from India. We've brought people who've had experience in Africa to come in and transfer the knowledge into making sure what's outside and what's good in terms of developing the system further is brought in through an expertise that allows us to now introduce new disruptive innovations and then do an imbibed environment where the younger generation now picks it up and eventually takes over running all these assets. So there's been a good initiative for us to get young Vietnamese to go into hospitals as well, form the second line, assist the senior CEOs into running the hospitals, but now using disruptive knowledge that they learned from us to deploy a lighter, faster, more innovative approach towards how we want to change the system.
Very good. Building that local talent, not just relying on outside talent necessarily. We talked about the trends in healthcare, but more from a macro perspective. And you mentioned some of the specializations and education that you're bringing in. What other trends at a more, I guess you could say, internal, like industry perspective are happening in Vietnam right now? Are we seeing more players enter the market? Are we seeing more Vietnamese companies really taking charge and leading the effort for innovation? Or even things like the talent pool? Like, are there enough future doctors being educated in Vietnam? I'd love to hear from an industry perspective what trends are emerging.
Well, doctors and nurses will always be a shortage. That's how it's been, and I think that's going to be as healthcare grows and provision grows and provision becomes more diversified into preventive and wellness, you'll still have that gap in terms of where talent is going to be available. So obviously with Hoan My, that's one of the reasons why we created the academy on a similar platform where we continuously train leaders, healthcare leaders and healthcare professionals to upskill and building on partnerships from a global perspective. For instance, we've signed with Frankfurt School of Management, and it's a 5-month program to train young Vietnamese to go into healthcare leadership in that sense. But from a trend perspective, obviously, yes, you see a lot of new players coming in. I'm sure you've been made aware as well. So we've got a lot of private equity funds coming in, buying up assets within the country. We don't see so many new healthcare assets coming up physically, but we do see digital being one of the areas where a lot of companies are coming on board. A lot of startups are coming on with digital offerings from healthcare, whether it's a referral system, whether it's teleconsultation system, or whether it's just purely from a technology perspective for EMR development, etc. The general practice market seems to be something that people are looking at. We've had a couple of people within, VCs, individual investors, who seem to think that the primary care market is something that they should be looking at as well. The other trend that we're seeing is from the payer perspective. Social insurance always being the base platform for payers within the country. But then when you see there's a provision gap from a payer perspective, then out-of-pocket has always been something that the Vietnamese patients had to entertain.
Is that rising as well?
That's rising. But you're seeing government taking a very strong step towards this. And I think recently there's been a regulation that's been approved by Ministry of Finance to have something called SHI Plus, which means now you could actually co-insure an individual along with the SHI, which reduces the out-of-pocket and basically allows a very low premium for a person to go into hospital, use the SHI as a base, and then come and co-pay using an insurance instead of out-of-pocket. So I think that's definitely trends that are moving from that perspective. Private insurance still very, I would say there's a lot of room for growth from that sense. So it's a mix where I think the ecosystem is definitely changing. And also a mix where really hard capital in terms of big capital projects would not be seen, because you're now looking at primary care, you're looking at home-based healthcare, you're looking at digital interventions, and you're looking at a lighter model of where accessibility can be built beyond hospitals as well.
You mentioned at the beginning the idea of incumbents who have been here a very long time, and also international companies that have moved in via private equity. For instance, your former employer, FE Hospitals, acquired recently. I forgot the group, Thompson Hospitals, I think it was. I want to touch upon that a little bit because the market obviously is difficult to enter, regulatory-wise, and rightfully so. I think to control not so much free-flowing money coming in, we have to care about the care and among other things. What is the future for Hoan My Medical Group? I mean, do you see yourselves going from 27 years to 50 years as an independent company? Are you interested in partnering? You mentioned some affiliations mostly on the education side and specialization, but is there a future on the more commercial and business side in terms of partnership? What is your thinking as the group CEO? And actually, I have no idea. Hence my curiosity for that.
So Hoan My is a legacy player.
Yes.
For us, we don't do anything short-term from that perspective, obviously from the history of our ownership as well, where we've been now with Claremont for quite some years, more than 11 years now.
Okay.
And I don't think the perspective of an exit is there. We look at staying and playing for a long time. The mission always has been to provide for the well-being of all Vietnamese. So our commitment to Vietnam is high. We're looking at growth, organic, inorganic, within our system itself, across the system. And now since we've created multi-brands and multi-offerings as well, we see that mix allows us now to spread out even wider than what we've done before.
Okay.
From collaboration perspective, obviously, we're looking at very smart partnerships where we think will add value to the system. And so that will continue. We continue to source for partners from a clinical perspective, from a digital perspective, from management perspective, from all spectrums of where we run the company. Disruption is important to us now at this stage. So whether it's external disruption or internal disruption, we'll continue to go in those areas as well. So if you would ask me about the future for Hoan My, we have been the largest and the most dominant in the market, where private healthcare has been since the beginning. And we want to continue having that leadership in the market. Obviously, the legacy model has worked very well over the last 27 years, but looking at how times have changed, how the country has moved on, and how demographics will move into the future, Hoan My will continue to be agile, flexible in terms of how we offer healthcare to people. And I think the most important point of where we stand as a responsible healthcare provider on the private sector in the country is to continuously make healthcare accessible and affordable for every Vietnamese individual.
I recently had other more legacy companies in other industries be on either my show or we've been on similar events and whatnot. And one of them was Masan Group. I just mentioned them very briefly because they're thinking very similarly. You know, the legacy company, they're building more subsidiaries across many other sectors even. And one of the things that the CTO brought up, his name is Rahul, was the idea of buying and building.
Yes.
They're very good at building, obviously, because they've been doing it for so long. But at the same time, they're recognizing that there's a gap in potentially not only expertise, but talent, especially as a larger company in terms of attraction or retention. Do you guys think about that? You seem to be building quite a few, and I'm sure there's some wins and some, not so many big wins out there as well. Are you thinking about the other side? So instead of having someone come in, are you thinking of going out there and getting players to enhance your capabilities? Has that been a thought?
There's always been discussions on how we grow. Obviously, in some areas where we find assets or hospitals or companies which have been going through the mill in terms of repeated private equity acquisitions, etc., we are a little bit more careful because as I said, it's always affordability that we look at. Sometimes the practicality of buying an expensive asset doesn't give us the affordability where we translate it to the customer's point of view, right? Okay. So yes, opportunity is always there. We look at different parts. We do greenfield, we do brownfield, of course. So if there's obviously a chance to consolidate something within the market where a player is attractive to us, we look at it. So there's different dimensions of how growth is, pretty much in that sense. But it must add value to what we do, and still give us the position of being responsible for providing affordable and accessible care.
Very good. Well, if you're listening to that, if you're interested in building, Hoan My is definitely doing that. They're hiring, I'm sure, exceptional talent, so be sure to apply. If you're a player out in the market, either through just affiliation through their academy or bigger, hopefully you're listening to today's podcast. We just have a few more questions here, and it's mostly about the community. And I'd love to hear how you guys get involved in, you mentioned CSR activities, and how you have your people, get out there and really work with partners. Talk us about how you guys are doing that. So not the academy side, that's more internal, but more on the outside. What couple of activities could you highlight for people to, aside from the breast cancer one that you mentioned?
So we've done well with obviously being spread out so much across the country. Our hospitals independently run some of the interventions within the communities because they're more engaged with the communities themselves.
Okay.
And at different locations or different areas of the country, there are different needs as well. Significantly, Hoan My Da Nang has done well with heart surgeries for pediatrics. They've done close to about 1,200 surgeries already to date, where they engage clearly with communities, a filtering process, a nomination process that goes on, and they screen children for heart diseases and eventually get the surgeries done within the hospital. A recent one which we did with Hoan My Win was to do Operation Smile. So we did 300 cleft palate, cleft lip surgeries there as well. The Mekong Delta obviously has a high predisposition of non-communicable diseases as well, which are unscreened. So medical camps, etc., go out, school education, which happens to children at a certain age, etc. So there's different touch points where we do community work, but the CSR projects that we do or the community interventions that we do are ongoing all year round. Obviously, seasonality plays a role as well. So during that, there's a lot of hype in terms of how we engage with community, and it's an opportunity for us to do that as well. So our screening programs, our community engagement programs start picking up during that or the first quarter of the year. Then obviously the spillover in terms of what we need to do in terms of surgeries or procedures for those children that we screen or individuals that we see will happen throughout the year itself.
This may have to be another whole podcast entirely, but I just mentioned it here. So I remind myself to follow up either now or later. Across the region, there's different challenges such as everything from air pollution to people's access to good water and food and whatever environment they're around. You guys must really know for example, maybe in the middle of the country, there's a higher rate of XYZ disease and similar to the Mekong Delta.
Yes.
Can you guys see what trends are emerging in terms of what's rapidly increasing, obesity even?
Obviously, what's worrying for us is lifestyle changes. I mean, you mentioned young individuals, and I see them as how your mom sees them as well. When I go for my run in the morning, there's nobody on the pedestrian walkway. And then when I come back at 6:30, you see all these young individuals gulping down sugary drinks and coffee and, all those things. So I think that's the biggest worry we have. Lifestyle setting in and becoming sedentary for the young individuals. Obesity is rising for sure. So you're seeing non-communicable becoming more apparent. Diabetes definitely rising across the country.
Okay.
Hypertension because of work or whatever stress factors they are, food-related, dietary-related, etc. So obviously pollution is one area that we see as being important. So airway diseases have definitely risen across the country and especially in larger cities. Generally across the board, how we see people getting into more non-communicable chronic diseases and untreated in most situations. So one of the initiatives that we're looking at is really to look into diabetes because from diabetes then you're looking at end organ damage with kidneys and heart and the stroke factor comes in. So I think that's where we stand in terms of looking into things. One thing that we're doing to actively generate more awareness obviously is to educate patients. But within each hospital that we have in the country, we're now creating centers of excellence that deal with diseases of such. I mean, obviously you have to treat, but most importantly is for us to see how we can reduce incidence. And I think one of the key areas of intervention, I mean, we've got 164 million cell phones in Vietnam today. 94 million people own at least one cell phone, and the average Vietnamese owns two cell phones as well. And we've realized that Gen X as well, they are the influencers for either their parents or the children within the family itself. So digital, as you said, how do you educate a Gen Z? It's through a digital portal because that's how they live and that's how they communicate with the world and how they derive information and knowledge as well. So in a nutshell, we really have to look, again, the middle class trap, right? Reduce growth in terms of population, increase in chronic disease, which is what we think is going to be something that we really have to tackle from a healthcare perspective.
Okay. No, very good to share that. And it's great to hear from a leader in the industry because something needs to be done is being done, thankfully, but hopefully more, especially as, Vietnam historically is a very industrious society. People are out, work in the fields and in the factories. Of course, that's not all today, but still ongoing today. And then suddenly this generation of sitting in an office all day. And it's not exactly easy to walk around Ho Chi Minh City with the heat, especially, right? And the rest of the country too. Thank you for sharing all these great insights.
My pleasure.
Dr. Dilshaad. It's been a pleasure to hear about the future of healthcare and how you guys are thinking at Hoan My. I've learned certainly a lot on this podcast. And as I prefaced in the very beginning, I ask all of our guests, who would you like to see on the show? Not a person necessarily, maybe it is, or an industry that you can learn from to do your job better. Could be AI, could be, agriculture, it could be airplanes, could be anything. It could be out of your personal interest as well, perhaps.
For us, what's intriguing is obviously balancing healthcare and services. So someone from the services industry would be good to have on the show.
Okay.
I think cross-industry sharings are important today as we transcend, into a boundaryless kind of an environment. So for us, it's very important to learn from the service industry into how they obviously create exceptional experiences for their clients.
Okay.
And for healthcare to learn how we can separate the outcome together with an experience or merge outcomes with experience and then create the whole holistic personalized experience for an individual, whether he's well or he's unwell.
Okay. Well, very good. So if you know anybody or you're an expert in that, feel free to write to us and we'll have you on the show and Dr. Dilshaad will be listening. Thank you so much for being on the program again today. It's been a pleasure and I wish the best for Hoan My in the next 27 years. And again, if you're looking for a new career in healthcare, feel free to reach out to Hoan My. I'm sure they'd be love to hear from you. With that said, thank you so much for tuning in for another episode of Vietnam Innovators. Dr. Dilshaad, the Group CEO of Hoan My Medical Group. Hope you enjoyed listening. Thank you so much.
Thanks, Hao.
And see you guys next time. Bye-bye.